setting up. Okay, this is setting up our triage table. To start, here are some of our drawers. Here we keep our glucometer, our lactate, and our ketone reader. It's a good idea to go through and just make sure that we have enough test strips of each and that they're actually in their appropriate location. Over here we have our suction. It's good to make sure that we have the tubing that goes from the suction to the canister. Make sure we have a canister, and then we have tubing here that will go to the patient. Up here we have our little disc. We want to keep butterflies, extra needles of various sizes, of 3 ml, 1 ml, some flushes, various things like eye lube, general sterile lube, maybe some vet wrap, some skin glue maybe, different blood tubes, because when you're in a bind you want to just kind of grab and go. Here's some bandage scissors just in case, and then various catheter sizes, a toothbrush for quick grab cleaning some clippers. You obviously want some clippers here. Moving over to our monitoring machine, this is our pulse ox that we want. It's nice to keep everything tidy, so in a rush you can grab everything, you know where everything is. So we have our pulse ox, we have our ECG leads, make sure everything, different ones have different attachments, so make sure you have everything you need, and our CO2, and then our blood pressure. Cuffs are kept up here as well as in here for our Doppler. While we're here, we are supposed to have 3 tap kits in here. There's a couple up here, one down there. Various oxygen mask sizes, so here's some large ones, there's some small ones back there. Here are some gowns so that if a kind of dirty situation comes in, we can protect ourselves. Here are some central lines. Here is some scratch paper for when you're in a bind and you need to make notes about what is being given and what time and how. Over here we have our oxygen lines. We want to make sure that this is good. Make sure there's no kinking, make sure it's off when it's not being used. You can see it's off, lefty, loosey, righty, tighty. Over here we have our cheat sheets, so our emergency drugs and doses, our algorithms, where to give CPR, etc. Down here in our drawer we need our T-ports, extra flushes, and our taping and our vet wrap for just in case. We want to make sure we have a fluid pump, so if we need to give a bolus of fluids, we can. Make sure it is charged, so if we have to move it, it'll have battery life to survive the move. And then over here we have our crash cart that we want to make sure is well stocked, and on top we keep extra forms like heaven forbid a pet does come in, we track what's given, what time, who the pet is, who's doing what, for how long, and what the outcome is. That is ideal. I think that's it.